Did you know you can have a family member as a patient advocate? So in an earlier podcast series, we talked about how I support my family and my loved ones with their care by showing up and being present and being the extra ear in the room to ask questions and to empower them to speak up. And also, I do things like slow the conversation down. And I can tell you, when you have that extra person in the room that gives you that support, it makes a huge difference. So in a recent visit, maybe like a month ago, I went to a visit with a relative, and the doctor was relatively on time. I was so proud of him. But he came in and he was kind of moving fast. And he's like, okay, no, what questions do you have for me? And I was like, hang on. All right, what questions do you have? Didn't you remember you wanted to ask this question? You wanted to ask that question? Y'all excuse my hat. I put it in the washing machine. And I should have never did that. And in that instant, he realized, like, oh, this ain't going to be one of those visits where I have my roller skates on. And it's important. So bring an advocate. If you feel like you're overwhelmed with a specific medical condition and you're in your emotions, so you're not really listening, bring somebody with you. Have somebody, I don't have my phone over here, on FaceTime to help navigate the conversation and to help you remember to ask questions. So a lot of times, if it is a specific situation with a loved one, I will go with them and I'll have my own list of questions that I'm asking, because I'm thinking about all the nutrition related associations with medication and how it causes dysbiosis, and how even though you're not giving them an antibiotic, these pharmaceutical drugs, many of them are having an antibiotic like effect on the gut. They have no nutrient depletions. What are we doing to monitor these things? So I have my own list of questions when it comes to my family. When I go with them, if they have invited me into that space as their patient advocate, I'm not every relative's patient advocate, but there are some where I am very intimately involved in certain visits and for certain specialty care. So I want to empower you to let you know that you can have a patient advocate. Now, if you say, I don't have any relatives, I don't have any friends, so I don't have anybody that can help advocate for me. If you're a part of a health or hospital system, they have patient advocates. You can make arrangements in advance to say, when I have appointments with this particular provider, I would like a patient advocate in the room with me. That helps too. And you can even meet with them in advance and say, here are the questions I have. Can you help me ask these questions? Can you help me remember to ask these questions? You can do that. You have that right. Now, if your hospital or health system doesn't have patient advocates, then one option might be to make 2 copies of the questions, whether you handwrite them or type them up and print them out. And as soon as the doctor, not the nurse, not the medical assistant, as soon as the doctor comes from, hey, so-and-so, how are you? If they even have that level of bedside manners, but most do, right? Most do. You can say, oh, I'm great. I have something to give you. Say it right away, because many times your clinician has a one-track mind. They're just coming in and they're just diving right into whatever they wrote in the chief complaint line for the reason for your visit. You can hand it to the nurse. I strongly recommend you not do that, and you hand it directly to the doctor when they enter their room. What you can say to the nurse is, I have a list of questions I need to go over with the doctor today. That's really important to me. Can you please include that in my chief complaint? Right? Which is the reason for a visit. Same thing as saying reason for a visit. So when we say chief complaint, you're not complaining, but it's just what brings you into the office today is what they're really asking you. So take those questions that you've written out on your sheet of paper. I wish I had a sheet of paper I can show you, but I can't. Everything has something on it. Yes, I can show you this, because your girl is reading so many articles right now. All right. So you could take the list of questions and you can hand it to them and say, these are the questions I'd like us to discuss. So yes, after you go through your questions, here are all the questions I have for you. Now, these are the questions I love the best. Oh, my questions can wait. Let's talk about you. Let's see what you have here on this paper. And they start asking, they're like, okay, so tell me more about that. Right? They don't jump right in with solutions. They say, well, tell me more. Where'd this question come from? And now all of a sudden that trust, that bond that should be there between your clinician gets stronger, because you feel seen, you feel heard in your humanity, and you feel like they really care about you, which they should. And then most of the time, those questions on the paper that you had helps to answer the questions that they already had for you. And they'll ask additional questions, or it can expand the visit and say, oh, I'm glad you brought that up. I didn't know you were thinking about fill in the blank. So I've taken that approach as well, and it works really well. It works really well too for doctors who tend to just have their roller skates on all the time and speak really fast, and that could just be their personality. So take time to do that. If it's important to you to feel heard, especially, take time to write your questions down. I don't care how old or young you are. It's always important to write those questions down, because I can guarantee you will forget a question. And it is so much harder to get the doctor back in the room after they've left to ask that question. And some of them can be a little flippant. Oh, schedule another appointment. I'm done. Not the best response. However, they tend to double book depending on their practice. And some practices triple or quadruple book. I will never understand that. I never liked that when I ran a medical center. It's not a good thing, but sometimes they do it because of the no-show rate. So you always have somebody there. The problem is when everybody shows up and they're on time, you're already behind schedule. So anyway, that's a podcast for another time. We're talking about, did you know you can speak up? Yes, you can. You can write your questions down. Yes, you can. Write your questions down. Write your question. Okay, I'm just tripping right now. Write your questions down. Remember to make 2 copies of your questions. So, for example, maybe you write it once on paper and the other in your phone, but you want to be able to write answers quickly. So if you're not a quick typer, don't start fiddling with your phone, because that's you're gonna lose your clinician. Okay, don't do that. But you could also type your questions and put them in the portal ahead of time and say, hi doc, I have an appointment on. Here are all my questions. That's another way too. If you don't have access to either write it down twice, or you don't have a printer. I will say sometimes they may not read it in advance as a part of chart prep, or a medical assistant will just fly off and respond at the handle, or a nurse may respond in advance of the visit. You got to weigh that. I mean, personally, when I put a message in for the physician, I want to hear from the physician. I don't want to hear from anybody else, especially because my questions are very intentional. They're very detailed, and I want to hear from the person trained to answer this. So you got to really keep that in mind. If it's simple stuff, then, I don't mind, whoever can answer it. But if you think that'll help your visit, then send it the night before, because then they really won't have time to respond. You can say, oh, I put it in the chart. Here's the problem with that. They have to respond to each one. So if you do take that route, you may get, they will put in a response and say, discuss that today's visit. Thank you for sharing. Just something like that. So just keep that in mind. You have that option as well to help get your questions answered. So remember, this particular podcast series, this particular podcast series is talking about, did you know? Letting you know what your rights are, letting you know what your options are as you navigate the health and wellness system is what I'll say. Today, we are talking about advocacy. So you can bring a family member or relative to your visits if you like. And I've noticed now since COVID, one person in the back. Again, you do have rights, and you can say, well, I would feel more comfortable having my 2 advocates with me at this visit, and one doesn't mind standing. They usually don't push back with that, but you have to, again, speak up and make that request. You can have hospital advocates come for visits if you need that. Just plan ahead of time. If you are being called in to go over results for a particular test that was done, and it's something that you just feel like you need support for, sometimes cancer diagnoses or other terminal illness diagnoses, and the life conversations, you definitely want to have somebody with you if you feel like you're not going to be fully present to hear everything that's happening and write things down and ask questions. Even if it's for a surgical procedure, that pre-op, you definitely don't want to go by yourself. Not because it's an issue of trust per se, it's because you want to make sure the person who's going to be with you, helping you on the recovery end of this, is hearing everything that's being said and writing it down. Now they'll say, oh, we'll give it all to you. Still write it down in your own language, because sometimes what I've noticed is I'll write everything down and I'll get the sheet from them, and half the stuff is not even on the sheet. So I'm just saying, always have somebody there with you to hear what's being said at the same exact time so that you can then ask follow-up questions. Because again, your clinicians, your physicians, they are human beings. They make mistakes. They may say something, say, oh, no, that's not what I meant. Oh, I'm sorry. I'm glad you asked that question. Let me clarify. Again, it's a relationship, right? It's not a one-way relationship, provider to patient or patient to provider. Everybody has to do their part to make sure there's clear communication, that we all are leaving with the same understanding and the intentionality that was communicated from both sides. So you can have an advocate. If you are that kind of person who doesn't need an advocate to come to the visit, that's fine too. That's great. I am that person. I don't need an advocate to come to my business because I'm going to self-advocate. I know what I want. I know how to communicate what I want. I know what I need. I know how to communicate what I need. And so I'm going to write my questions down because I'm not telling you to do anything that I wouldn't do to make sure I don't forget, because I'm like, I'll leave the room like, oh, dang it, I had one more question. Right? And again, it's harder to get the doctor back once you've left their presence, especially if you slow the conversation down. So if you forget, you better just go ahead and put it in the portal and say, hey, I had one more question I forgot to ask you. Thank you so much for answering all my other questions. And then wait the day or two to get the response, depending upon, their schedule and things like that. So I hope these, excuse me, Did You Know series are helping you. We're going to stay on Did You Know for a minute, but right now we're focusing on speaking up. Did you know you can do that? It's okay to ask questions. So in the next podcast, we're actually going to talk about those consent forms they have assigned and walk through what they are and what they mean and know what your rights are with that as well. Until next time, remember, I'm here to inspire you to take your health back one meal at a time by eating more plants and creating this community in health, because that's what this podcast is all about. But did you know you could speak up? It's okay to ask questions. Ciao.